Professor Wijns, President of the EuroPCR. Very good to see you here. We did an initial interview already at the EuroPCR, but there was a little hiccup in the sound, so we redo it now here again. So very pleased that you are here, and I think we all can look back at a terrific EuroPCR. Of course, was a lot of interest for the QFR also, as we are promoting that. You have been involved in the QFR from the very beginning. You know everything that we have been doing, and would like to have your opinion now that you see how far we are. How do you see that in the research, in the clinical routine? Where do you see that it will go to?
Thank you, Hans. You're right. I really enjoyed working with the team and you on QFR, and from the onset, I was convinced that it would play an important clinical role. And now, after a couple of years of hard work, it shows. I think it can be very useful in centers that do not have interventional or surgical capacity, where only diagnostic angiograms are performed, because QFR, without any use of adenosine or extra wires, allows really to qualify the severity of the ischemic burden and impact on the decision where to refer the patient to, if he needs intervention or surgery, or perhaps if medical treatment is enough. So that would be one major indication.
Yeah.
Very important probably in emerging countries or in areas where there are a significant number of diagnostic-only cath labs.
Yeah. And
there's more.
Okay, why don't you continue?
Yeah. Well, I think in every interventional center, it has become now, I think, high-level recommendation that physiological assessment should be available. So QFR can certainly play a role there. And we've seen that it helps to classify the severity and the extent of the disease. Many patients who seem to have triple vessel disease, once you start measuring, turns out to be only one or two vessel disease, and of course that changes the classification of the patient, hence the therapeutic options. So that's a strong added value that is available ad hoc, almost, at the time the diagnostic angiogram is performed. Then there is clinical situations where specifically this can be very helpful. And what comes to mind is acute MI intervention. Patient comes in the middle of the night. Half of the patients have multivessel disease by angiography. Once the culprit lesion is treated, what about the non-culprit? And here again, there is a great opportunity, I think, for QFR to allow evaluation of non-culprit lesions. Mm-hmm. And that doesn't mean you need to treat them immediately if they're significant, but at least you know exactly what sort of treatment you should schedule for that sort of patient.
Yeah.
Then there is other situations that are becoming more and more common, like TAVI. Again, many patients will have anatomic lesions, coronary disease, and I think here that's another opportunity to complete the evaluation of the patient and decide whether PCI should be considered or not, either before or after the TAVI. So these are just a few examples of clinical situations where I think QFR can play a major role.
Just to come back also to your point of the multivessel disease, we just had this last week or weekend also a live case from the Netherlands, and it was such a patient with assumed three-vessel disease. Then the coronary arteries were measured with the QFR, and it turned out in the end it was only one vessel disease. And the single vessel was treated with the stent, and that was all. And you see the enormous change from patient comes in as three-vessel and goes away with a treated single vessel disease. So that was really demonstrated very clearly, and that is also what we see now every time where we do the live cases and where we do the clinical studies, that the area of applications opens tremendously. The more you do it, the more you also see the opportunities.
Yeah, and what it brings to clinical management. This is a great example, as you mentioned, for sure. It will help planning the procedure. And the other aspect that I find important as an interventionist is that it is, by essence, co-registered. So you can actually see where the pressure gradient is more important, and it will certainly influence procedural decisions like stent length and instance,
Exactly.
sample size, obviously.
Yeah.
And then there is one other very important indication, I think, for the future, because it needs to be solidified with outcome data. But in today's era of value-based healthcare and accountable treatment, etc., I think it's very important to have a tool at the end of the case. When it looks good, you should be able to also measure that it actually is good functionally.
Yeah.
And QFR could play a major role here at the end of the procedures to
Yeah.
qualify the quality of the results.
Yeah.
Have we restored the conductance of the epicardial vessel, or for some reason, either the stent is not well expanded or there is diffuse disease? Is the patient still at risk? In which case, he can be treated more aggressively with drugs and lifestyle modification.
Yeah. And that was, among others, for example, the late break clinical trial by Professor Campo with the Hawkeye trial. That was also looking at post-PCI and prognosis of the patient, and that was also very, very well received.
Yeah, I think there is an increasing awareness that the angiogram is not giving us the full picture. We know and we accept that from a diagnostic perspective prior to therapy. Now we also have to acknowledge that in the context of post-PCI therapy.
Yeah. So a lot of work to be done. Lots of clinical studies. As you know, also we are now carrying out the outcome study, Phase 3, in Europe, Japan. That is now has started with including patients. So next year PCR will be too early to come with some results. Maybe I don't think any initial results, but we certainly look forward to PCR next year again, where I'm sure now that we also start soon in the United States, that hopefully, say, broadening the scope and the application, that we will have, as you, also a very busy PCR, both for the QFR but also for you as the organization. I think it's really a terrific place to be, and we look forward to be there in 2020 again.
We're delighted to have you here, and of course this, I think, is the great platform to expose the community, particularly the best practice examples from sites that are working actively with QFR.
Yeah.
It's a good platform to show it, and I'm sure it will disseminate from there very quickly, and we're happy to have you in the coming years, particularly once we have outcome data, because then it will be high-level recommendation to actually use it. Yeah. So congratulations, great job.
Well, thank you also for being here
Thank you,
for
Hans.
the interview.
Thank you. Pleasure.